Hello everyone and welcome to Ovarian Cancer Australia's Information and Support webinar. My name is Hayley and I'm the Support Coordinator here at OCA. Before we begin, I would like to acknowledge the traditional owners of the land on which we're standing and pay my respect to their elders past and present. I would also like to thank the Brockhoff Foundation for providing us with the funding opportunity to deliver this project. Today's webinar is on the theme of survivorship. The webinar is interactive, so over the next hour you can ask questions of the presenters by typing into the chat box which is located at the bottom left-hand side of your screen. Your questions will be answered at the end of each speaker's presentation. Please keep in mind that our presenters cannot address individual medical cases. If you have particular questions, please feel free to call the OCA Information and Referral line. If you're experiencing any difficulty in hearing the sound during the webinar, please dial the 1800 support number listed in the chat box. We are very pleased to welcome our presenters for today, Associate Professor Michael Jefford and Jan Antony. Jan Antony is an ambassador for Ovarian Cancer Australia. During her career, she has worked as a photographer and has run various home-based businesses. At the age of 49, Jan was diagnosed with breast cancer, and subsequently, in 2008, she was diagnosed with stage 3 ovarian cancer. At the time, she said, "I felt as though I was in a parallel universe and no longer had any connection to those around me, as they had a future and I felt I had none." 8 years later, Jan says, "If I could offer any advice to women with ovarian cancer, it would be this. Surround yourself with those who replenish your soul with laughter and joy, and cut out those people who bring you down. And when you're not having treatment, don't live your life as a patient, just live your life." Associate Professor Michael Jefford is Deputy Head of the Department of Medical Oncology at Peter MacCallum Cancer Centre and Director of the Australian Cancer Survivorship Centre, which is Site Legacy. He has extensive experience designing interventions to improve the supportive care outcomes of people affected by cancer. He has led research and contributed to program development, service delivery, and to the international literature regarding cancer survivorship. I'd now like to pass you over to Jan Antony to share her story.
Well, just to give you a bit of background on myself, I'm 72 years old, I'm divorced, I have a daughter of 30 I love madly, and a faithful hound called Mr. Darcy who shares my home and my life. I'm retired, but I still help out a friend in his office for a few hours a week. In May 2008, I went to the doctor as I was having some digestive problems, and he organised some scans to check my organs. And I happened to mention in passing that I was bloating rather a lot in the last few months and was getting fatigued. He added an internal ultrasound just as a precaution. It was stage 3 ovarian cancer, and the rest is history. No doubt many of you have similar stories. And it really isn't any wonder they call it the silent killer, because these symptoms are so vague. 5 days later, I was on the operating table being vacuumed out, not just my ovaries and uterus, but my appendix and bits all over the place, including the back of the bowel. Chemo followed, and though the thought of it terrified me, I found it was bearable. You have one bad week, one okay week, and one really good week. I have to tell you though, I hated losing my hair. There's no such thing back then as ice caps, and I would gladly endure the discomfort of that to retain the hair. I was fortunate to be able to join a trial halfway through my first round of chemo for Avastin, and that is now on the list and is available for all. 2 years later, in May 2010, the cancer returned. Again, I had an operation followed by chemo, but this time kept my hair. Hooray! And things were fine for another 2 years, but the cancer returned in May 2012, this time in the form of a tumour on the liver. Again, I was operated on, but did not require chemo, which was bliss. 18 months later, in November 2013, the cancer returned, this time as a tumour in my abdomen. I had surgery, but again, no chemo. We're all survivors if we are here to tell the tale. What I want to share with you today is what has worked for me in managing this journey. You take from it what you will, as there are many paths you can go down, and I'm not saying mine is the best. Thank heavens you can listen to Michael after me, as he will give you the good stuff. Once a round of treatment is over, I don't dwell on the cancer. I believe it helps enormously if you don't live your life as the cancer patient, but you simply live your life. I remember my surgeon saying to me as I staggered home from the huge first stop, "Jan, I want you to get out of the house from day one. Even if you can only manage to walk as far as the house next door and then back, it stops you seeing yourself as a patient and it gets you back into life." Although mostly I can put the cancer in the back of my mind, I still get in a state of panic 3 days before a checkup. The fear of it returning is immense. At times like this, I just get through it as best I can, but it's only for a few days, a few sleeps. I have always asked questions of the medical team, as I firmly believe that knowledge is power. If you have knowledge, you've become involved in the decision making and you feel you're more in control, and actually this makes you feel less like a victim. An excellent starting point is the resilience diary that ovarian cancer provides patients. It's actually very dangerous to trawl through the internet unaided. This book recommends reliable sources of information and provides the details you need on the disease and its treatment. Ovarian cancer also run information sessions to bring you up to date on the latest research and trials and so on. So do make the most of what they have to offer. The very only good thing about chemo was that I bonded with two of the most amazing women I've ever met and actually had rather an enjoyable time at chemo, as it was a great chance to catch up. Deb even brought champagne to the chemo sessions. I've lost my... there I am, sorry. We'll try again. Deb even brought champagne to the chemo sessions. My cancer buddies are unfortunately no longer with me, but they walk with me every day of my life. The important thing about talking to other patients is that they actually really get you. They get what you're going through. And you have someone to laugh with on the good days and someone to lean on the bad days. Again, ovarian cancer, through their many events, can help you connect with other patients. I think this is crucial. There's no getting around the fact that some people do drain you while others replenish. I surround myself with people who love life and make me laugh. I cut ties with all those acquaintances who drag me down. Life is too precious to spend with people who don't let the sun shine in, though I still carry a feeling of guilt that I'm still here and my best buddies are not. Be kind to yourself when you have the blues. Look, it doesn't matter how positive you are, there'll be bad days. I tend to spend mine wallowing in self-pity, playing Dylan loudly and drinking red wine, though God forbid you follow me in that respect. But having shed the tears, I then put it behind me and get on with living as joyfully as I can. What works for me personally is to let it rip and wash it all out rather than internalise it and intent to soldier on. I think women can tend to feel guilty if they're not always appearing to be coping. I strongly suggest checking out what trials are available, as they're a great way to access new treatments that sometimes are not available for years otherwise. It is a fact that women on trials tend to live longer than those who are not on trials. And you're constantly monitored, so any problems are detected at an earlier stage. You're also going to do your bit to make things better for women in the future. I remember I constantly plan little adventures as a reward so that I can focus on some pleasant thing in the future. I've just booked a cruise on the Queen Victoria around the Mediterranean next September. There's optimism for you. And we'll be excited about it for the next 11 months. But it could be something as small as a picnic by the sea. I always planned a little treat in the 3rd week of the round of chemo and then a great big one at the end of the final session. As for diet, I don't obsess about it. I've always eaten relatively well, and I enjoy cooking even for myself. But more often than not for dinner, I'll have something with a lot of vegetables and a side salad. But I'll also indulge myself at times as I really enjoy food. And I have been known to have a glass or two of wine when I'm out with my friends, like tonight. I also recommend getting a dog. They give unconditional love, and hey, it sure as hell works for me. Not only that, Mr. Darcy forces me to walk in day and night, and this makes me exercise. I don't really do enough exercise, and I know Michael's going to say I should, and I'm going to improve this in the near future. I've already made an appointment with a clinical Pilates instructor to help me with balance. I've also started meditating, which I find particularly helpful when scary thoughts refuse to go away, and it helps me sleep. I've been in remission for the last 3 years, and after 4 major ops, I have more scars than Frankenstein. I get tired more easily, and my feet are still tender to walk on. Also, my stomach muscles have been cut and no longer exist, so I look forever 7 months pregnant. But I consider these a small price to pay, and emotionally I feel great and am enjoying life. I've never focused overly on alternative treatments, though I understand they work for many people. But look, having said that, I swear by my acupuncturist and give him a lot of the credit for my still being here. I remember the first time I went to him was when I was about to undergo the first round of chemo, and I could only get into him before 3 of the 6 sessions. It's a fact that when I saw him before a chemo session, the symptoms were way, way down. I consider this to be evidence-based. He does not claim to cure cancer, but he strengthens the immune system so you can fight it better. He's a very wise man, and he tells me little stories to help. I remember one he told me when I was fretting about the future. Jan, some problems are like pebbles, little pebbles, others like stones, and some are as big as rocks. Be like the river, flow round and over them and move on. In times of stress, that image comes to me. I hope you find some of my ramblings useful. Just remember, yesterday is history, tomorrow is a mystery, all we have is now, so live for today. Thank you.
Jan, that was really useful and really interesting to hear your perspective. I have a few questions now. I have a feeling that some more questions will come up towards the end. You spoke briefly about some of the physical after effects, which is something that Mark was going to talk about as well. And you talked about scars and some of the aspects of the surgery. Did you experience any other physical side effects or late effects, I guess, of chemo?
Yeah, to hear. Can you just tell me
late effects of chemo or
the after effects?
Yeah, of the chemo. Yeah. Side effects.
Yeah. The side effects of I'm not on, am I?
Yes.
I'm on? Oh, sorry, I beg your pardon. The side effects of chemo. You obviously get very tired. You go through nausea. You go through enormous trouble getting the bowels moving. At the end of it, I had a little trouble with my fingers, getting them to feel again. As I said, my feet are still rather tender. I think the hair falling out is awful because it makes you feel and look like an alien. And it has a big sign above your head saying, I'm suffering from cancer, and I didn't like that. I think being able to wear an ice cap and perhaps preventing that is a wonderful invention. Mostly, though, the symptoms did go away when the chemo finished. I can't say, apart from slightly tender feet, that I really have had any problem, and I've had 2 major run-ins with chemo.
About the scary thoughts. That's a bit of anxiety about recurrence, because that's what a lot of women speak to us about.
Busy in the day, it seems that you can keep these things in the background, but sometimes fear creeps into your room in the middle of the night, and I think one just has to accept that having a run-in with cancer, a boogeyman did jump out of the dark, and you no longer feel secure that he won't jump out again. So it's something that is going to happen. And I think, for me, the best way is to, again, like the river before, to let the thoughts come in, don't fight them, just let them come in and let them slide out the other side. I then will read or get up and watch TV for half an hour, something, anything to divert, and then go back to bed. But these thoughts are going to come. Just accept them. Say, there's this thought coming, it's not good, and just let it stay there and wash over. Don't think about it. That works for me.
Thank you.
Thank you, Jan. That's really useful.